About a new public option in health care intended to cover the tens of millions of people without health care insurance. You may have seen the president give a preview of his plan this morning, and he will lay it out in greater detail tonight on an ABC special live from the White House. Yes, you heard me right, an ABC special live from the White House. But what's really going on, and how does this affect you directly? Chief Washington correspondent Jim Angle has the latest. Jim.
Hello, Judge. Well, it looks like the process is slowing down just a little bit, at least on the Senate side. After all, this could change the way Americans get their health care, and most Americans are happy with the health care they get now. Now, Democrats in the Senate said they are unlikely to have a bill before the July 4th recess, Judge, and they're still struggling to find ways to pay for a bill that they estimate will cost a good bit more than $1 trillion. And, of course, both the president and Democrats in Congress have said they want a bill that will not increase the deficit. So right now, the search is on for the revenues to cover whatever they decide to do, Judge.
The options, Jim, are all over the map, and some in the House of Representatives are still pushing for what's called a single-payer health care, meaning what? A single national plan for everybody?
Yep. That's right, a government-run insurance plan. In fact, witnesses in 2 House hearings today argued that is the only way to get universal coverage, the only practical way, they argued, to get national health insurance. Needless to say, there are a lot of lawmakers who reject that, and there is little chance that single-payer could pass. In fact, even President Obama, Judge, has said that will not happen.
So what do we expect the House of Representatives is trying to come up with?
Well, they've got proposals all over the map. The effort there is really to have a government-run option that would compete with private insurance plans. But that also hit a snag today when a private group estimated the cost over the next 10 years at $3.5 trillion over 10 years. So the Democrats, though, have put no price on the bill, nor have they said how they would pay for whatever it costs. Democrat Charlie Rangel, who's chairman of one of the committees, rejected the criticism, saying he heard all the same arguments when people were debating Medicaid and Medicare. Of course, Medicare now has a $36 trillion in unfunded liabilities, Judge, meaning that's how much it would cost to cover all the promises Congress made, but doesn't have the money to pay for.
Got it. Jim Angle, thanks very much. Let's bring in Dr. Eric Novak. He's chairman of Arizonans for Healthcare Freedom, and Reverend Jesse Lee Peterson. He's the founder and president of Bond Action. Reverend Jesse, to you first. Is the concept of the federal government providing health care for everyone a fraud or something we really need and want in this country?
It's a fraud, and I have to tell you, Judge, if you want to know what the government provided health care look like, take a look at the health care facilities around the country and the inner cities around the country. The service is awful. Long lines. They're trying to provide service for illegal aliens, everybody, and it's just absolutely bad. For an example, in South Central Los Angeles, Dr. Martin Luther King Hospital went out of business because the quality of service was awful, waste of money. I mean, literally people are dying in the waiting rooms. And even in the emergency facilities around this city, for sure, there are long lines waiting. It is absolutely bad. And I do want to add that we do not have a healthcare crisis in our country. According to the survey of USA Today and Kaiser Foundation, 89% of Americans are satisfied with their health care providers. This has been made up by the Obama administration, Obama himself, the Congressional Black Caucus, ACORN, and others.
Right.
They believe that if they could create a bad situation, the people overreact to it, then they could get what they want.
Government always likes to create a crisis. Dr. Novak, to you, what are you folks doing? I think it's a great idea. Explain it to us. In Arizona,
sure, Judge,
to address this.
Thank you for having me. Yes,
sure.
The legislature just referred to the ballot for 2010 an initiative called the Healthcare Freedom Act. And everyone can learn more about it at azhealthcarefreedomact.com. But it would put 2 rights into the state constitution. First of all, it protects the right to always be able to spend your own money for any legal health care service. Second of all, it prevents the government from penalizing you with taxes, wage withholding, or any other penalty if you choose not to participate in any government-run or government-sanctioned health care plan.
All right, so in other words, if the courts allow Arizona law to stand, and, you know, somebody will challenge it in the face of what the feds will probably pass, in the state of Arizona, you'd have the fundamental right to say, no, I'm going to take care of myself, I'm not going to take any government program, and you're not going to force me to buy insurance that I don't want to have.
That would be the plan. It would be in the state constitution, and it would always protect the rights of people to spend their own money, because fundamentally, health care reform ought to be about protecting patients, putting them first. And putting patients first means putting in some ground rules to prevent people from Congress and the big special interests from coming in and really carving out regulations that benefit themselves and their industry and really don't care about me and my family or you and your family or the Reverend and his family. So that's really what this referendum is all about, and the legislators of Arizona really should be commended for putting it on the ballot.
Reverend Jesse, if you are right and the president is wrong, and I think you are right and the president is wrong, then why is it that they want to force health care down our throats as if there were some authority for this in the Constitution?
Just as they've done with everything, Judge. First of all, Barack Obama, the Messiah, is a socialist. He has the same mentality that we've been seeing over the last 50 years from the liberal Democrats. We've seen this with people like, you know, the Congressional Black Caucus, Jesse Jackson and others. These people hunger for power, and what they have to do is to demoralize the people so that they become needy of the government. And so bringing in this health care gives these people power. And also, you have to realize that Obama is no different than Jeremiah Wright Jr., the NAACP and others. They hate white Americans, and they especially hate the white man and what they want to do. That's why Obama said that he believed in the redistribution of wealth, because they want to take the power away from the quote-unquote white man and give it to the people who they think deserve it, and it's the people of color. This is a dangerous man. He should not be trusted, and we definitely don't want to turn our lives over to him.
This is going to stir some debate. Reverend Jesse, Dr. Novak, thanks very much. We want to remind you